All right. Can everybody hear me? Yes. Okay. All right. My neighbors over there are telling me they can hear me. Okay. Hello and happy Tuesday. My name is Jordan Anderson, and I'm a community health nurse with Two Rivers Public Health Department. And this is March's monthly surveillance call. I'm going to stop my video. All right. So Two Rivers, where we are, we serve almost 100,000 individuals in 7 counties that cover approximately 4,624 square miles. And these counties include Buffalo, Dawson, Phelps, Kearney, Harlan, Franklin, and Gosper. And you can see over here the populations of each of those counties separated up to make our total. Our mission and our vision here. I won't read them for you. And then this is our Two Rivers nursing team. So Jackie Haley, our leader, she's our supervisor. And just a note on her, she got married in December and her new last name is Haley, and starred right there is her new email address. So you have jhaley@trphd.ne.gov. So just so everybody knows to update your contact on her on your end. And then we have Marilyn, Liz, Rosa, Rita, and myself. Our website again has changed. I know it's been changed for a while, but still just a reminder, we are trphd.ne.gov instead of .org now. And this map was developed by Health and Human Services and FEMA. And as you can see, Nebraska falls in Region 7, along with Iowa, Kansas, and Missouri. So you can see us right there in the middle, number 7. This is your COVID update. It was updated on 3/8. So we have 103,672,529 nationwide confirmed cases. Our 7-day average per 1,000 people is 51. Compared to Nebraska, our 7-day average per 100,000 people is 77.9. So we are a little bit above the national average. And there you can see our total confirmed, our deaths, as well as the rest of Region 7. All right, this is a brief explanation of the dashboard on our website. In the top left corner, you have the rolling 7-day average of COVID cases. So this is a comparison from February 13th through March 12th. This year is in orange and last year is in blue. On average, there have been more this year than last. You can see there's a lot of fluctuation there as well. In the bottom left, we have our weekly tests versus those that are positive. So there's a pretty steep increase the week of February 19th, and March has been pretty steady. There in the middle, the number of cases per day has averaged about 12 cases in the last week. The top right graphic, the county levels are in green, which is low compared to some of our neighboring districts and counties. As you can see, those in yellow and orange. The bottom right graphic, it looks like the people testing positive for COVID is fairly comparable among age groups. Aside from that 0 to 9, you can see there's significantly less. And the groups with the most are 30 to 39 and 80 plus. Here we can see how Nebraska compares to the rest of the United States regarding flu activity. Nebraska's activity is in the light green, so minimal. We are seeing a decrease, but as always, CDC recommends continuing everybody keep up on their influenza vaccinations. Looking here at Nebraska's influenza specifically, the most updated data indicates that influenza A and B cases both have decreased. The 2 most common influenza subtypes are H1 and H3, H3 causing most of the cases. Good news is that this season's flu shot does provide coverage against both of these subtypes. And flu-related ER visits and outpatient visits are up, but hospitalizations and school absenteeism are down. Lastly, there have been 49 flu-associated deaths, including 3 pediatric deaths. And here is Nebraska's RSV weekly data. The cases are down, and there have been 23 RSV-associated deaths this season. Here is the COVID data tracker weekly review. It was updated on March 3rd. It talks about simplifying COVID vaccine recommendations. This would include phasing out the monovalent vaccines and replacing them with the bivalent versions. This would only affect those people who have not received the primary vaccine series, and the FDA would need to authorize it before CDC could make any recommendations. For several weeks, there has been a decrease in COVID-19 cases, hospitalizations, and deaths, and much of the country has protection against the circulating strains, either through vaccination, previous infection, or a combination of both. Those subvariants do continue to emerge, so reinfection is still possible. Additionally, the Biden administration announced that on May 11th, 2023, that will be the final day of the COVID-19 public health emergency, which has been in effect since January 2020. That doesn't mean COVID is ending. COVID is still here, just the public health emergency is ending. So stay tuned for upcoming announcements regarding those changes. March 4th was HPV Awareness Day, and cervical cancer is just the tip of the iceberg. Every year in the United States, 36,500 people, both women and men, are estimated to be diagnosed with a cancer caused by HPV infection. Although cervical cancer is the most well-known of the cancers caused by HPV, there are other types of cancer as well. Cervical cancer is the only type, though, that has a recommended screening test. The other cancers may not be detected until they cause other health problems. HPV vaccination could prevent more than 90% of cancers caused by HPV from ever developing. And here's just a little graphic showing HPV infections targeted by vaccine, how they've decreased since the vaccine came out. And it is recommended that all patients age 11 to 12 get the HPV vaccine, men, women, all of the above. Whoa, sorry about that. Two Rivers offers HPV vaccinations at any of our VFC clinics, regardless of insurance status. March is also Developmental Disability Awareness Month. So according to the Centers for Disease and Control, developmental disabilities are defined as impairments in physical, learning, language, or behavior areas, and include autism spectrum disorders, cerebral palsy, attention deficit hyperactivity disorder, learning or intellectual disabilities, hearing loss, vision impairment, other developmental delays, and you can see the graphic here with all the little circles around it are included in that as well. And through a campaign each March, the National Association of Councils on Developmental Disabilities and the Association of University Centers on Disabilities join forces to highlight the ways in which people with and without disabilities unite to form strong communities. As always, our Life Smiles program is still seeing patients in our district doing those free dental screenings ages 0 to 4. You can find their clinics on our calendar right there. We are still COVID testing Mondays and Wednesdays from 9:30 to 10:30 by appointment only. You can register for that at trphd.ne.gov. Our vaccine clinics are still on our TRPHD event calendar. A big change this month, our monthly Buffalo County Fairgrounds Clinic has now been moved to our main office. So from 5 to 7 p.m. on the third Tuesday of every month, we won't be at the fairgrounds, we'll be here in our office. So kind of a big change there. And that's all I have. Are there any questions or comments? All right. If not, we will be sending out the monthly education along with these slides and the video link. And thank you all for joining this clinical call, and have a happy and safe St. Patrick's Day. Thanks, everyone.